Welcome back to my YouTube channel. I'm datsweetnurse. Thank you to all our returning subscribers for sticking to our educative channel. And if this is the first time you're coming across our videos, please don't forget to like, share and subscribe to our channel. So let's move into what we have today. So today we'll be talking about something very important to my dear sister. So it's not like if you're a guy you should go. No, you need this information to know how to treat your sisters better and to treat your wife better, or our wife to be better. And then what are we talking about? It's dysmenorrhea, and dysmenorrhea is simply a medical term for painful menstruation or menstrual cramps. Now you see, one thing about menstrual cramp is the fact that it's person specific. So it has a lot of it ranges from mild to moderate to severe pain. So I might be experience mild pains while it's severe for the other person, and it can be severe for me and it's mild for someone else. So it's actually wise that you do not judge me based on someone else's experience of menstruation. Like, you should not judge me based on it. So it's person specific. So now let's talk about the types of dysmenorrhea we have. We have the primary and the secondary dysmenorrhea. Now the primary dysmenorrhea is when you have this pain that comes with your period each time. Like, this period, this month the pain comes, next month the pain comes, and it is not attached to any underlying condition. But for the secondary dysmenorrhea, you're having this pains as a result of an underlying condition. And most of the times this secondary dysmenorrhea, many people experience it because our body as women send most of the things that happens in our reproductive organ, send the same or almost the same warning signs or signals as a sign and symptom. So you might be having lower abdominal pain and you don't even know that it's actually something else. You're now thinking it's because my period is on the way. No. So if you're having these severe pains, I suggest that you go and see the doctor and get yourself screened so that they will rule out PID or UTI or anything that can be of a great damage to your reproductive organ when you're thinking it's dysmenorrhea. Now, what are the signs and symptoms of dysmenorrhea? Now, these signs and symptoms are still similar to the signs and symptoms of menstruation that throbbing pains in your abdomen, you're feeling severe pains in your lower back, your abdomen, in between your thighs, nausea, vomiting, headache. Them, like that feeling like as if you wanna run mad, like you're losing it. So that's basically what you might feel when you're having dysmenorrhea. And now, what exactly causes dysmenorrhea? Now, menstrual cramps or dysmenorrhea is actually caused by this chemical called prostaglandin, which causes your uterus to tighten up. Now, when menstruation is about to set in, there is an increase in the level of the prostaglandin, which will cause your uterus to tighten up more strongly. So now the tightening up is actually what causes the cramping and the discomfort that you feel. So I know how you feel right now. You feel like giving this chemical, this prostaglandin, an uppercut, but it's actually trying to do its work, because the tightening of the uterus will actually help the uterus shed off the lining. That it will help shed off the uterus lining. That's the tissue and the blood that leaves the vagina during your period. So you see, before menstruation, there is an increase in the level of the prostaglandin, and once menstruation sets in, the level of this prostaglandin reduces. So that's why you see that the cramps tends to ease off after a few days once your menstruation starts. How can one now manage dysmenorrhea? For me, this is the aim or the purpose or the sole goal of this video, to enable how you can walk through this pain of dysmenorrhea. Menstruation is something that happens to us women for a very long period of time, and it's actually going to be disheartening if you have to go through this process in pain. So firstly, you will have to use the non-steroidal anti-inflammatory drugs, and you can go to a pharmacy a day or days before your period, or once your period starts, to get these drugs. Now, one thing about these drugs is the fact that I've learned through experience not to call names of drugs on videos like this, because patients can be very amazing. So tomorrow they will not say sweet nurse said this particular drugs is good for menstrual cramps, and then they will take it even when it's not supposed to, and at the end when a problem comes up, then it falls back on you, because actually you actually said it in your video. So once your period is about to start, just go to the pharmacy and they will tell you how to make use of these drugs. And then secondly, avoid smoking or drinking, and then avoid foods or drinks that contain caffeine. And then you can make use of this warm compress over your lower abdomen and your back and your thighs. And then you can also get someone to help you do a massage over your lower abdomen or your back to help ease off the pain. And then ensure you exercise regularly, and know that sleep is actually very, very important. That ensure you rest properly during this period. And then know that your diet influences your health generally. So if it's going to influence your health, it's definitely going to influence your menstrual flow. So please ensure that you eat healthy food, you take in more of leafy vegetables. Just ensure that you stay away from carbs, from carbonated drinks, from refined sugars. Ensure you eat healthy so that you will reduce your pain of, or your chances of having this dysmenorrhea. That's reducing the pain. So I know now that you are beaming with smiles, because with this video you've learned how to walk through this pain till whenever your menstrual flow ceases to come. So you will know that you already have this information on how you are going to walk through this pain. And I know you will not want to hold this information to yourself, so do well to share this video to others, like and subscribe to my YouTube channel, and don't forget to turn on the notification bell to see more educative content like this. Thank you.